Hello, I'm Arman Memarzadeh. I'm a trauma and orthopaedic surgeon at Cambridge University Hospitals. I'm also a private knee surgeon offering private knee surgery at Nuffield Hospital and Spire Hospitals in Cambridge. My specialty is the full spectrum of knee surgery, all the way from young patients requiring instability treatment or ligament reconstruction, all the way to patients with arthritis who require joint replacement. And that includes partial knee replacement, total knee replacements, and robotic surgery. My main passion is for individualized alignment or personalized knee surgery, and I'll explain what that is in due course. There are lots of reasons why I became an orthopedic surgeon or a knee surgeon. One of the first things is that I became quite inspired by lots of trainers, both at medical school and during my surgical training. That had a big impact on me, and I wanted to follow in their stead. The second reason I wanted to go into trauma and orthopedic surgery is because of the variety in the job. I've got all the way from meticulous surgical planning to lots of patient-facing clinics, as well as working with other specialties and other medical professionals. That keeps the day interesting. No 2 days are the same, and that I find really exciting in my life. And the final reason that I really like orthopedic surgery is because I get to treat patients of all ages, all the way from young patients all the way through to the elderly, and that's what I find really rewarding. The rewarding thing about knee surgery in particular is that it's one of those surgical specialties that has a really high success rate. So I make people better with my operations in a lot of cases. I have lots of happy patients, but that also means that I get patients back to doing things that they love doing. So I get patients to go back to playing sports, playing football or skiing. And also some patients will get back to walking the dog pain-free. And that's what I find really rewarding. So aside from my surgical skill, I think they really appreciate my communication skills. I make patients feel at ease. I can explain complex surgical concepts in very kind of lay person's language, which then means that I can connect with everyone and they can understand the information that's given away. I get a lot of good reviews on this, both verbally and online, and feel free to check that out. The thing that I always tell my trainees is that you'll only pick up things that you look for. So for this reason, I'm really meticulous when I ask questions about patients' pathology, and when I'm examining them, I do lots of different tests to assess their knee in various ways. And my surgical planning is also meticulous, and the way that I review X-rays and MRI imaging is very systematic. So I am a firm believer in that, and that's my mantra. Personalized knee replacement is a new concept, a relatively new concept. It encompasses lots of different things, but in my mind, or for me, personalized knee replacement is tailoring the cuts for a knee replacement to the patient's own anatomy. So we're all slightly different, and what personalized knee replacement can do is tailor the alignment of your joint replacement to your own personal anatomy to within the degree and millimeter. This is done using a robot. The idea is that with the knee replacement being in the optimal position for your knee, there is a perfect balance of your knee ligaments, which then means that the knee moves better and feels more like your normal knee. This has been shown in research to have better outcomes, and it's intuitive to say that if the ligaments are well balanced, your knee is going to move better and the outcomes will be better. I would say that this is superior to doing a knee replacement using manual instrumentation, simply because some of the manual instrumentation was developed in the 80s. So this is really the new technique, new way of doing. However, it's not available everywhere, so you really need to make sure that your surgeon is trained and able to carry out this procedure for you safely.